here's the big one. California is poised to be, if this proposal is supported, the first state in the country to achieve universal access to health coverage. So what does that mean? It means full scope Medi-Cal, including long-term care, IHSS, behavioral health to all low-income Californians, regardless of immigration status, regardless of their age, regardless of their immigration status. Full implementation will initiate January 2024 if this is approved. I want to thank Senator Durazo, so many others, Arambula, so many leaders in this space. There are strong advocacy for decades, even prior to those leaders, decades, those that have been advocating for universal coverage. We're going to do it. We said we're going to do it. We said it would take a few years. We're committed to doing it. $614 million, it's not on this slide, $614 million is the general fund for this 2022-2023 budget year, and it annualizes at about $2.2 billion general fund in the out years. So 614 in this budget year, 2022-2023, annualizes $2.2 billion into the future. Building on that, want to remind you of some of the past actions we've taken. Again, big part of our focus, and we'll talk briefly about it here in a moment around CalAIM, is the integration of brain and physical health, integration of mental health and substance abuse, issues of integrating around the whole person, meaning as an individual with so many comorbidities, so many challenges that make us human, and opportunities to address. So much of that integration is a big part of our focus. That's why transforming our behavioral health system is so foundational. This no wrong door policy, which will be part of all of our contracts, I think by July. We can get Dr. Galley and others to follow through in more details on that. We also committed, as you saw, to more facility investments in the last couple of years, more focus on crisis centers, peer supports, but also reimagining our children's behavioral health. And this is so exciting. It really is. No other state, I don't know, maybe there are, to be fair, but I haven't been reading about a lot of other states that have committed, except rhetorically, to investing 0 to 25, well, $4 billion to completely reimagine our screening services for our children. I mean, I don't need to tell you the stress and the anxiety that our kids have been under over the last few years, particularly as it relates to COVID. This is serious, and we are taking it seriously, and there's $4 billion in multi-year investment in this space. Last year, we put $1.4 billion, and this year, year two of that $4 billion investment is an additional $1.5 billion for our kids. And that's, again, an exciting proposal. It connects dots in our school system, and that's a multi-year vision that we are doubling down on. Speaking of $1.4 billion, I mentioned this a moment ago. We're creating this brand new Medi-Cal benefit for community-based mobile crisis intervention services. Again, this could easily be in that homeless bucket, but I wanted to include it more broadly in the healthcare bucket since it is a Medi-Cal benefit expansion. $1.4 billion. Deal with those in crisis, mobile units, intervention, out on the streets. Very exciting proposal. And one that is long overdue in the state, as is the focus on those that are decomposing, those that can't represent themselves, those that need stabilization and diversion to the extent they can, that are found, quote unquote, incompetent to stand for trial, what we refer to as ISTs. I can go into great detail on this, but suffice to say we have a responsibility as a state to do better in this space. We haven't. We own that. And this is a commitment, firm commitment. Dr. Galley's one of his top priorities, and that's reflected in the budget investment in our state hospitals here. Briefly, just on CalAIM, we've talked about it in the last few years. For those that say, well, more is not better, better is better. For those that say, boy, what are they doing about reforming their healthcare system that has about 14.5 million Californians, a third of their population? Well, this is what we're doing. We're reforming the Medi-Cal system. Reforming payments, reforming our entire approach. It's called CalAIM. We got the Biden administration to support this effort. That wasn't easy. Easier, the Biden administration, but not easy to get the federal government to sign off on first in the nation reforms, true whole person care, better coordination, not just short-term, but long-term care. This is exciting. All the justice-involved populations, folks, before they get out of jail, county jail, we actually are going to make sure they're screened for Medi-Cal eligibility, fill out a form, and learn that they actually can avail themselves to primary and preventative care. So they don't end up out on the streets and sidewalks. Health equity, I mean, you see the whole gambit. And so this is year 2 of this multi-year commitment, $2.8 billion this year to move the needle and to advance these, as we love to say, once-in-generation reforms.